So, hello everyone. In this video, I'm going to be discussing the PECARN Validation study. It can be a complicated study to get to grips with. However, I hope through this video, I can help you better understand the study overall. So first, we're going to be going through the general information of the study and then moving on to discussing the procedure, some supplemental documents, and your role as an RA when screening and enrolling for validation. So let's go ahead and cover some basics on the one-page summary. So the principal investigators of the study are Dr. Holmes and Dr. Cooperman, and they're right up here. And this is Dr. Cooperman. And the purpose of the study is to validate two previous studies which determine the decision rules that doctors use when deciding whether or not to use CT scans on pediatric patients with head or abdominal trauma. And the reason for carefully selecting these rules and criteria is so that doctors can limit the amount of exposure to radiation by using CT scans only when there's a good reason to do so. So before we get into the inclusion and exclusion criteria, it's important to note that validation consists of two sub-studies. One is called the intra-abdominal sub-study, and the other is called the head sub-study, or TBI. And with these two sub-studies, they're somewhat independent of each other in that a person can qualify for one sub-study and be enrolled into validation, or they can qualify for both sub-studies and be enrolled into validation. So before we look at the specific inclusion-exclusion criteria for the IAI sub-study and the TBI sub-study, we can discuss kind of the general inclusion and exclusion criteria that kind of spans both sub-studies. So our role in this validation sub-study begins with identifying possible eligible patients. So as this is a pediatrics study, only patients aged 0 to 17 will qualify. Overall, we're screening for patients that have experienced blunt, non-trivial trauma to either the head, abdomen, or both. So common chief complaints for validation patient include MVA or motor vehicle accident, any of the trauma codes such as 911, 922, or 93, falls, and this can be especially true for infants and toddlers, head trauma or abdominal trauma. Sometimes you might see abdominal pain, head pain, or headaches. And while these don't always end up being validation candidates, it can definitely be a patient you want to look into once more information is available on the cause of the pain. Aside from these general inclusion criteria, there's also key exclusion criteria we want to screen for. One factor that would exclude a patient is if the trauma is not a blunt trauma, but penetrating. Examples of penetrating trauma would be a bullet wound or any injury resulting with the from a penetration of the skin. Another example apart from a gun wound could be a knife wound. And the penetrating trauma isn't penetrating trauma to any area of the body. It's only specifically to those two areas for the sub-studies we're concerned with. So that would be the abdomen or the head. So for example, if you had a patient that potentially qualified for validation, but you see that there's a penetrating trauma to the foot, then as long as they don't meet any of the include or exclusion criteria for the specific sub-study you're looking at, they can be included into validation overall. However, if that penetrating trauma occurred to the head or abdomen, then they would be excluded from the study. Another exclusion criteria is if the time of injury exceeds 24 hours from the time they arrive in the ED. So if they've had an injury 48 hours ago and from the time that they have entered the ED, then they would be excluded, or for anything greater than 24 hours, they would be excluded. Additionally, pregnancy or pre-existing neurological disorder that complicates physical examination would also exclude the patient from the study. Now that we have kind of covered the basic inclusion and exclusion criteria that kind of spans both sub-studies, we can kind of delve into each individual sub-study and look at the specific inclusion and exclusion criteria for the abdomen and the head studies. The first sub-study is the intra-abdominal injury sub-study, or the IAI sub-study. We kind of discussed the general inclusion and exclusion for validation overall. And one of them is the age inclusion criteria. So they have to be less than 18 years of age. This is not less than or equal to. If they are 18, then they are going to be excluded from the study. As for the rest of the inclusion criteria, there's 4 here, but only one of these inclusion criteria has to be met for the patient to be potentially enrolled into validation, or specifically into this sub-study. So the first one that we're going to be talking about is a blunt torso trauma resulting from a significant mechanism of injury. And significant mechanism of injury is defined as anything in this parentheses. So an example is a motor vehicle collision if it's greater than 60 miles per hour, or if the patient has been like ejected during the motor vehicle collision. Another is any kind of falls greater than 20 feet in height, and or like physical assault involving the abdomen. In regards to the physical assault, one time in which we do not enroll patients is when there is a high suspicion of child abuse. And that goes for both sub-studies, not just the IAI. So if there's a high suspicion of child abuse, then they are going to be excluded overall from validation. So one way we can find out whether there's a high suspicion is by looking at the patient's chart. If you see an order for a bone survey, and or if you're speaking with the attending and the attending voices suspicion that there is child abuse. The other exclusion or inclusion criteria is decreased level of consciousness in association with blunt torso trauma. So if their GCS score is less than 15, then they are going to be or they can be included into the study. And the third inclusion criteria is blunt traumatic event with either of the following, either extremity paralysis or multiple long bone fractures in multiple sites. And the final inclusion criteria is history and physical examination suggestive of IAI following blunt torso trauma. So that could be either a CT scan was ordered, an abdominal CT was ordered, or there's been laboratory screening for IAI. Some examples of laboratory screening could be urinalysis or CBC. If those have resulted abnormal, then or they have resulted abnormal following blunt torso trauma, and that could be suggestive of IAI, then they might be included into the sub-study. And we're now going to talk a little bit about it. The exclusion criteria, the first one is penetrating trauma, and that's penetrating trauma specifically to the abdomen. So if they have penetrating trauma to the foot, but they don't meet any of the other exclusion criteria and they've met the inclusion, then that wouldn't necessarily prevent them from being enrolled from the study. So that is specifically penetrating trauma to the abdomen and not just anywhere to the body. Another exclusion criteria is pre-existing neurological disorder that seriously complicates physical examination assessment. And the physical examination assessment is done by the attending. So this is something that we would talk with the attending about. And then the other exclusion criteria is if the traumatic injury occurred more than 24 hours ago. As for these 3 exclusion criteria, they're the same for validation overall. Differing for penetrating trauma is whether it's the head or abdomen. So in this sub-study, we're specifically looking at penetrating trauma to the abdomen. The 4th exclusion criteria is transfer of patient with a prior abdominal CT. We're going to discuss this a little bit more because it tends to be a point of confusion. And the last exclusion criteria is known pregnancy. So the next sub-study we're going to be talking about is the HEAD sub-study, also called the TBI sub-study. And similar to the IAI sub-study, the age inclusion still remains. They have to be less than 18 to potentially qualify. Another similarity is that they only have to meet one of the inclusion criteria to be included into this sub-study. So the first one is if they've had a non-trivial blunt head trauma, and that also includes any signs or symptoms of head trauma, or the presence of scalp lacerations or abrasions, especially if they've had nausea, vomiting, or loss of consciousness. And that's something we want to double check with the attending. Even if there's a low suspicion, they might still qualify for the study. And the second inclusion is that there's a head CT that's been ordered for the patient. And most of the time, a head CT will always be ordered if it is a non-trivial blunt head trauma. So you can kind of treat them as one inclusion, because if a head CT is ordered, then most likely it will be due to because it's a non-trivial blunt head trauma. Exclusion, one of the exclusion is if the head trauma is trivial, and some examples are on your one-page summary. So one of them is if they fell from ground level, then that would be considered trivial head trauma. Also, if they were walking into a stationary object, that could also be potentially trivial. And that's something you also want to double check with the attending at the time to see if they would consider the injury non-trivial or trivial. Another exclusion criteria is penetrating trauma. Again, that's penetrating trauma to the head only. So if they've had penetrating trauma to another area of the body, then that wouldn't affect their enrollment into this sub-study. The third exclusion, and this one is similar to IAI, if they've had any pre-existing neurological disorders that seriously complicates the physical examination assessment, then that would exclude them from the study. And if the traumatic injury occurred more than 24 hours ago, that's throughout all of validation. So if an injury occurred more than 24 hours ago, then they wouldn't qualify for validation overall. And the next exclusion criteria is if if they were transferred with a prior head CT. So that would also exclude them. I wanted to elaborate more on this because that tends to be a point of confusion for a couple of RAs. And I think the best way to kind of put that is through an example. So let's say a patient came in with, or they had an injury, and they initially were sent to Sutter and Davis, where they had a CT abdomen, and then they were later transferred to Sacramento to the UCD emergency department. So in that case, they've had a CT abdomen, so that would exclude them for the IAI sub-study, but that doesn't mean they would be excluded from the head sub-study. So they would have to have a CT head at Sutter for them to be excluded from this specific sub-study. So it's important to kind of keep track of what CT's been done in prior hospitals to determine if they are excluded from one or both of the sub-studies. Another exclusion, and this one is new to the head sub-study, is if they've had a pre-existing brain tumor or bleeding disorder, that would exclude them. And the last exclusion is if it's a known pregnancy, then that would also exclude them. Okay. Now that we've talked about the inclusion and exclusion criteria, let's now move on and talk about the procedures to follow in the ED when a potential validation patient comes in. So our first step is to look through the EMR chart to identify any new patients and see if they potentially qualify for validation. So you're going to be looking for patients with chief complaints that might indicate trauma. And earlier on in this video, we kind of talked about some of those chief complaints. That could include motor vehicle accident, if it specifically says abdominal or head trauma. It could be falls, It could be any of the trauma codes, so 911, 92, or 93. So we're going to be looking and kind of scanning for those chief complaints, as well as keeping an eye on anything that's being ordered in terms of CT scans or labs for the patients that are coming in. So let's say you've identified a patient and you've scanned through their chart. At this case, or at this point, there's two possibilities. One is that that person qualifies, so that that means that either they've met the inclusion for one of those sub-studies and have not met any of the exclusion, um, or the other possibility at that point is that the patient does not qualify. So there could be two reasons for why the patient does not qualify. So either that they haven't met any of the inclusion criteria, or they've met the exclusion criteria. So first, we're going to kind of discuss the procedure to follow when you've screened for a patient and that patient does not qualify for the study. And then we're going to talk about the procedure to follow when the person qualifies for the study after you've screened them. In the event that the person you screen for does not qualify for the study, we have a separate procedure, and we fill out this form that you see on the screen, and this is called the screen failure sheet. It'll be found in our research office, and to have a brief look through it, on the front page, we can see we have to check why this patient was excluded. So there's two reasons, as we talked about. Either they didn't meet the inclusion criteria or they met the exclusion criteria. Or it could be both, in which case they wouldn't qualify for validation. And then on this side, we have the patient sticker. This is where we put the patient sticker to turn in this form. And then right down here, we have the name of faculty or the attending responsible for that patient. So we just put the doctor's name if the patient that you screened for does not qualify, and the date here as well. And on the front page, you can see that there is a list of the inclusion criteria and the exclusion for each of the sub-study. So we have this top portion right here is for the IAI sub-study, and this bottom one is for the head sub-study. And then on the second sheet, we have this portion down here, which we have to fill out. Essentially, it's like who completed this form. If you've done it, just click RA, and then just print your name there, and then afterwards you turn it in. So in terms of like how to fill this out, so right down here or right up here, we'd have your reasons for why the patient was excluded. So let's say they didn't meet any of the inclusion criteria. In that case, then all of the inclusion would just be no for both of the sub-studies. And remember, they can still qualify as long as they meet the inclusion for one of the sub-studies and don't meet any of the exclusion. So it doesn't necessarily have to be that they have to meet the inclusion for both of these sub-studies. As long as they meet them for one, they could potentially qualify for validation. So if you were to check this box, didn't meet any inclusion criteria, you just put a line through the nose for both of these, and then fill out your name and turn in this form in the BPOD doc box. And the other criteria or why they were excluded is that they met an exclusion criteria. So you would just check here if they met any of the exclusion. You just leave a check mark there, put a patient sticker, put the name of the faculty member or the attending responsible for the patient, and then check the exclusion that was met. So let's say they had, in the case of an IAI, they might have had penetrating trauma to the abdomen. So you just put a check mark here, and then in that case, it would be excluded from IAI. And that goes for TBI as well. So any exclusion that they've met, you just check the box. print your name at the end, and turn it into BPOD doc box. And that kind of concludes the procedure we would do in the event that the patient does not qualify for the study. We'd follow the screen failure procedure. So you've screened for this patient and you find out they don't qualify, you'd fill this sheet out and then place it in the BPOD DocPod. So let us now discuss what to do in the event that the person you screened for does qualify for the study. So the first thing you want to do is go ahead and grab a Form 1 sheet, and this is what the cover sheet will look like. And it's going to be located in the BPOD doc box, and it's going to be a couple of pages long, and it's going to have a paper clip on top of it, and it's going to be attached to two other little sheets of paper, and these are called letters of information, or LOI for short. And you want to hang on to these until we approach the patient later on. So we go ahead and hold on to the letters of information. Now we have the Form 1 in hand, and we're going to go ahead and approach the attending. Before we approach the attending, you want to print a label out, a patient label, and paper clip the label to the top of the Form 1 sheet. The reason we don't glue in the sheet is that when we ask the attending and the attending says that the person might not qualify for a reason that you didn't realize when you were screening, we can just go ahead and reuse these Form 1s. So if we were to stick that label on, then we wouldn't be able to reuse them, and we would have to shred the entire Form 1. So let's say now that you have the Form 1 in hand, we're going to go ahead and approach the attending to confirm that the patient qualifies for validation. So most of the attendings, or pretty much all of them, are going to be familiar with the study. So when we approach them, we're just going to have a quick, really quick conversation, like one sentence, asking them whether the person qualifies for the study. So the difficult point of that is just figuring out when to approach the attending. They're going to be very busy for the majority of the time. So we want to be really careful to not disrupt their duties in terms of patient care. So we don't want to hover over them for long periods of time. So we're just going to wait until they're going to be sitting at their desk, and they've been sitting there for more than a couple of minutes. Then we're just going to approach them. So just go ahead and introduce yourself. Just be like, hello, Dr. whoever it is. My name is Hari, and I'm here with MRAP. We'd like to know if you believe the patient in room B2, let's say, is eligible for the validation study. And from here, the attending could either say that they are eligible, or they are not eligible, or the person does not qualify. If the person does not qualify, we want to know why that is. So you'd want to ask the attending why they think the person does not qualify, kind of verify the reason, talk to the RC if they're present, about why the person does not qualify, and follow the screen failure sheet procedure. So that's the event. That's what you would do in the event that the person does not qualify for study. We'd ask them why and fill out the screen failure sheet. Let's say that the attending says that they do qualify. In this event, we're going to hand the attending the Form 1 and hang on to the letters of information until we meet the patient. And then during the course of the shift, we want to check in with the attending to see if they're in the process of filling out the form. But we don't want to do that every couple of minutes or so. We want to do it in increments of 30 to an hour. And additionally, if the attending leaves the packet on their desk, you can look it over to see if it's been completed. So you can go through the questions to make sure everything's filled out. And we're gonna cover on how to fill out the Form 1 and just give, and I'm just gonna give you a general overview of the Form 1 later on in this video. So the next thing that we're gonna be discussing is the approach and consenting for validation once the patient is confirmed by the attending that they do qualify for the study. So to recap, at this point, you would have screened for the patient, talked with the attending to confirm whether they qualify for the study, and have handed them the Form 1, or have handed the attending the Form 1. The next step is to go talk with the parents or responsible adults in the patient room. And for this study, we are going to be approaching to consent for a follow-up phone call only. We're not approaching to consent for enrollment to the study. If a patient qualifies, they're going to be automatically enrolled. So the only thing we're going to be consenting for is a follow-up phone call. And we're only going to consent for a follow-up phone call for patients who are going to be discharged. And we're going to talk about what to do in the event that either the patient is going to be admitted or we don't know whether they're going to be admitted or discharged. And if we scroll down a little further into our one-page summary, so right down here, the next step is to determine whether the patient is going to be admitted or discharged. And that we can determine by looking at the color next to their name. So discharged patients will have a green color, admitted patients will have a blue color. And then if we don't know whether they're being admitted or discharged or status is unknown, then they're going to have a red color next to their name. So if they're going to be discharged, we have to go ahead and approach to consent for the follow-up phone call. If they are not going to be discharged and they are going to be admitted, then all we need is we need their primary language and the time and date of injury. So most of the time that can be found by just talking to the nurses, and we don't approach patients if we know that they're going to be admitted, and especially if they've had serious injuries. On the other hand, if the patient is going to be discharged, we're going to approach them to consent for the follow-up phone call if they are okay to be approached, or if they're clear to approach by a nurse. If the patient status is unknown, we want to wait until we know the patient status. However, if there's a time constraint or there's no RAs after you who can follow up on the validation that you screened for, we are going to approach and consent, but we're going to have a different script in which we state that they are going to only receive that follow-up phone call if their child is going to be discharged from the ED. So let's say the patient is going to be discharged. In this case, we need to go ahead and consent for a follow-up phone call. The first thing we do is we go ahead and grab a blank piece of paper and write down the information we need to collect. And that information includes name of the parent or guardian or responsible adult in the room, their relationship to the child, their number, their preference, whether they or preference for contacting, so text or call, estimated time of injury, because remember it has to be within that 24-hour timeline, and their primary language. So this information is going to be needed to fill out the Form 1 when you get it back from the attending. So one of the things that we have to be aware of is the primary language. So we can consent in 2 languages, so Spanish and English. And the reason we can consent in these 2 languages and not others, even though we might have translators, is because we only have letters of information in English and Spanish. So we do not approach patients who are non-English or non-Spanish speaking. In the event that you do have to approach a Spanish-speaking family, a family member can translate for you, so as long as they're over 14 years of age and that they're fluent in both English and Spanish. If there is no family member that can translate, we would have to contact a Spanish interpreter, and the instructions are clearly laid out in your one-page summary. So we can either use a vocera or use the internal phone to contact the interpreter. Now that we talked a little bit about translators, let's talk about what you're going to actually say when you approach the family. So before we approach the family, we want to talk to the nurse, see if it's okay. If they say okay, we want to knock on their door and ask them if it's okay to talk with them for a minute or two. And if they say okay, then we're going to enter the room and talk to discuss the study with them. Now, when we're discussing the study, we want to make sure to avoid any kind of jargon, so we're not confusing anybody, and making sure that everyone understands what we're talking to them. And this is especially true when there's a translator in play. It makes it easier for the translator to understand what you're saying. Therefore, they can make sure that they're translating whatever you're saying properly to the family member. Now, on your one-page summary, there is a script laid out for you on what you're going to say to the family members. So you start off by just introducing yourself. Be like, hello, my name is Hari. I'm part of the research department here in the ED. And then we want to show some sympathy to the family because this is a trauma study, so the kid is going to be hurt. In most cases, it might even be severe. So I want to say, I'm so sorry to hear about your kid's accident, and you are allowed to make small talk with the family if appropriate at the time. And then we go ahead and talk about the study itself. So you would proceed by saying, we want to talk to you about an active study we're conducting. It's a study on kids who come in with possible head or belly injury to see if the rules regarding when doctors should or should not order CT scans for children are working the way they are supposed to. So your child does qualify for the study and is enrolled in the study. And here's some information on the study and the HIPAA form explaining what information we're going to be looking at. And we would like to call you or text you in a week or two to see how your kid is doing. Is that okay? That's something that you want to practice with. So that's kind of the general script. And if you ever want to refer back to it, it's also on your one-page summary. One of the things that, I don't know if you were able to catch it, but instead of saying like abdominal trauma or head trauma, instead you want to say head or belly injury when you're talking. And that kind of goes back to not using jargon in your language. The other thing you want to do is when you're talking with them, you want to hand them the letter of information that you've held on to when you first got the Form 1. And remember, that's just for them to keep. We don't take any signatures. If they grab a pen, make sure to tell them that they don't need to sign anything, and that's completely okay. And in most cases, after you ask them if it's okay to contact them in a week or two, the parents will say okay. If they do, then go ahead and collect the information that you had noted down on a white sheet of paper. That would be the name of the parent or guardian, their relationship, phone number, preference, text or call, primary language, and time of injury, and anything else you need to fill out the Form 1. If they do say no, you want to mark that on the Form 1 that they refuse to follow a phone call. And if they don't want their child to be enrolled in the study, you want to make a note of that and then attach that to the Form 1 when you turn it in. So the script that we just discussed is going to be used when we do know the patient status. If they're going to be discharged, that's something that you would say. But let's say the patient status is unknown. This would be the case most of the time since it takes a while for the final decision to be made by the trauma team. So the procedure is mostly going to be the same. We do want to wait until we know the patient's status, but if time is a constraint or you're about to leave your shift or there's no other RA coming in, then we are going to go ahead and consent them. But when we do speak with the parents, we want to mention to them that they will only be receiving that follow-up phone call if their child is going to be discharged from the hospital. So at the end, after you hand them the letter of information and ask them if they're okay with receiving a follow-up phone call, you want to say, if your child is going to be discharged from the hospital, we would like to call or text you to see how your child is doing. Is that something you're interested in? So you want to mention that they'll only be receiving that follow-up phone call if they are going to be discharged from the hospital. And this is the change in script, only used when if we don't know the patient's status. The last thing I wanted to discuss is how to finish enrollment for the study. So at this point, you would have screened the patient, found that they're eligible for enrollment, given the Form 1 to the attending in charge of the patient, and have consented the parents for the follow-up phone call if their child's going to be discharged or if their disposition is unknown. If they're admitted, then we do not consent for the follow-up phone call. All we need to know is their primary language and the time and date of injury, which we can get by asking a nurse. So you want to get the Form 1 back from the attending, but you don't want to pester them or hover over their desk. You want to ask them every 30 minutes or to an hour And if you see the Form 1 on their desk and it's been filled out, you can go ahead and grab it to fill it out and turn it in. So the thing that we're going to discuss next is kind of an overview of the Form 1 and what you need to fill out in the Form 1 and what you need to double check. To go over Form 1, I'm going to be walking you through this PowerPoint, and this PowerPoint is on your Canvas, so you can follow along by yourself or through this when I'm projecting it. It might be a little bit difficult to see, so I suggest reviewing it later, possibly on your own, or pulling it up on the side and just walking through this with me. So this is the cover sheet of the Form 1, and it's going to look something like this. This is the front of it, and this is the back of it. And the green sections throughout this PowerPoint are going to be areas that you're going to have to fill out as an RA. And the red is going to be what the attending is going to fill out. So we're going to focus in on this portion down here in the next slide. So this is what that portion is going to look like. And it's going to ask who consented, the parent or guardian. So if you went up to the parent and you're the one that discussed the study with them and collected the information, then you would put your name here and you would have, you would just check RA. And the next box right here, and we're going to discuss who's going to put their name here, but if you're the one that consented, you shouldn't review your own form for completeness or accuracy. This should be someone else. So you shouldn't have two of the same names in both of these boxes. And this would be who reviewed this form for completeness and accuracy. It can either be an RC or another RA. And right below it is RC acknowledgement. So if there's an RC on duty, then you would want to hand them the form and just have them look through it. And this box right here is for any kind of communication. So if you used a translator, you would just put, as it says right here, parents were consented in Spanish using a translator. Or if there's no RC on duty, you could also put that there is no RC on duty down here. Other things you could put is you could also say if the patient status is unknown, you can also report the patient status is unknown. But if the patient status is known, then you'd want to check either, whether they were discharged or admitted down here. So we're going to look at page 2 or the back of the cover sheet, and that's this portion. And that is, this is what that's going to look like. And whoever puts their name here in this, who reviewed this form for completeness or accuracy, should have gone through this checklist. So they're going to be checking the entire form for completion. So this is going to be the actual Form 1 that they're going to be looking and not just the cover sheet. So they're going to check whether the physician's name is on there, the patient MRN, label, the date and time of injury, as well as all of the information like contact information. And you can see that there's 2 boxes for contact information. Either it was collected or they weren't collected because they were being admitted. But regardless of whether they're being admitted or discharged, you need to know their primary language. So we just put primary language, and whether letters of information was given to them. And this should always be yes. You shouldn't miss on checking, or you should never not give them the letters of information unless you didn't go ahead and consent. So if the patient was admitted, you're not going to be approaching them. So in that case, you don't have to hand them a letter of information form. But if the patient was discharged and you consented them, you should have always given them the letter of information. And this is right down here. It was if you missed the patient. So this would be the patient was discharged, but the family wasn't consented, then you would have to explain why the patient or family was missed in the enrollment process for the follow-up phone call. This would be the top of the cover sheet, or second page of the cover sheet, and at the bottom, right down here would look something like, or it's going to look like this. These are areas that the attending has completed, and you just want to double check that these have all been filled out. And for every enrollment, regardless of whether they're admitted or discharged, all of these boxes has to be checked, because that's something that the attending has to fill out, and we're just double checking. And this is the actual Form 1 or page 1 of the Form 1. This is the inclusion-exclusion criteria. So this is something that the attending will fill out. And right up here is something that we complete. And the portion that we complete is going to look something like this. All we're doing is listing the attending's name. So right up here, you just write their name. And then you would put a sticker right down here. So you just print a sticker with their MRN label, and you would go ahead and put that there. As long as the sticker has an MRN label, it doesn't matter what sticker you use. It just has to have an MRN label. And this is the area that is filled out by the attending. So this is something that the attending will go through and check yes or no in terms of inclusion and exclusion. This is for the IAI. Attending will fill this out. Same for, this is the TBI study. This is something the attending will fill out. So the next portion we fill out is at the bottom of page 2. And this is going to be all of the information that you would have collected when you went ahead and approached the family members. The top portion is something that RAs cannot complete, even if we have this information available to us through the chart. We cannot fill this out. So this is something the attending has to fill out. And this is a closer up look on what the attending fills out. So that would be the race and ethnicity. We cannot fill that out, as well as mechanisms of injury, and the GCS score is something that the attending will fill out. At the bottom of, however, this is stuff that we are able to fill out, or an RC. So it's going to ask us date and time of injury, and it has to be within 24 hours. So that would be the date. And this is the time of injury. So the time of injury is the only thing that can be unknown. And that's only unknown if you can't figure it out through looking at the chart or talking with the attending, the nurses, the family members, or anyone who brought in the child. If by talking to all of those or looking at the chart, you can't figure out the time of injury, then you can click this unknown. But that would be the only reason you'd click it unknown. Otherwise, this should be filled in. And the date should always be filled in because it has to be within that 24-hour range. And right on the side of it is the date and time of EDE valve. And that's something that can be found in the chart. And this is the bottom of the page 1, or page 2 of Form 1. So it's going to ask name of the parent or guardian or anyone who spoke with in terms of family member. It's going to ask you're going to list their name as well as their relationship in parentheses, their number. So preference should be call or text is something that you would have asked them. You can also ask them for an alternative number for guardian or parent. Same thing, phone number and preference. And the principal language should be checked. And at the bottom here, it says, if primary language is not English, does parent or guardian responsible family member also speak English? That should always be a yes. The only time it can be a no is if they are Spanish speaking, then they don't have to speak English because we can use a translator. For any other primary language, that should be a yes if we went ahead and approached them. And the bottom one is was letter of information or HIPAA form given to the parent guardian. Again, that should be yes. The only time should be marked no is if the patient was admitted or we didn't approach them because we didn't speak English or Spanish. And at the very bottom, this would be a checklist for, or this would be a check mark as if they refuse to follow phone call, you just go ahead and place a check mark here. And as for the primary language should be filled in regardless of whether the patient guardian refused phone call or if they're being admitted. So that's something that we have to fill in. Okay. Moving on to the rest of the Form 1. This is stuff that we cannot complete. That's filled out by the attending. And it's going to have 2 sections. We're going to have the IAI subsection right here. And later on, after the page 3 and 4, we're going to have the TBI sub-study. So the first thing you want to make sure is if the patient qualified for one of the sub-studies, we want to make sure the attending is filling in the correct portion of the Form 1. So let's take a closer look at the TBI portion. So the first bit that's going to be asked is this chart right here. And something that has to be noted is one way you can double check the attending is if they marked any of these boxes, then this should have a mark yes. So if you see that they marked these boxes and there's nothing marked here, that's something you want to go double check with the attending to see if they made a mistake or if there's something that they want to fix by looking at it again. Again, at the bottom, this is something the attending fills out as well. And we'll just want to double check that it's filled out and everything is correct. So if there was an abdominal CT that was ordered, then we want to have something that's filled out in this section. Again, another thing to double check is if there's something that asks to complete another portion, if they marked yes. So if you notice that they marked yes, but there's nothing here, then you want then you want to go ahead and ask the attending to ask them whether they meant to check no or ask them to fill this portion out. So that was kind of an overview of the IAI, and we're just going to look through the TBI really quickly to kind of see where you'd want to potentially double check to see if it's been filled out correctly or not. So one of the first areas is number 4. You can see that if their GCS is less than 14, then they would just stop. If it's no, then they would go ahead and continue the TBI form. And then the other area is you want to make sure that they're filling in the right portion for the age. So if the child is less than 2, then they'd fill this portion out. If the child is greater than or equal to 2, then they'd fill this portion out. And the other thing you can catch when they're attending, if they mark something here, but there's no mark here, then that's something you want to double check because it says, if yes, answer the questions below. So if you see that the attending has marked here something here, then you want to ask them whether they meant to say yes or no. Also, if they marked yes, but they didn't mark anything here, you'd want to go ahead and double check with the attending and ask them to fill the bottom portion out. Again, if there was a CT order, they'd want to check through this. So that's also another area that you can double check, as well as these types of questions. So it says if they mark yes, then they'd have to complete these 4 questions. So if they mark yes and you don't see anything marked here, then you'd want to take the Form 1 back to the attending and ask them to fill it out again. So that pretty much concludes the quick overview of the Form 1. There is one last form that I want to talk about. It's called a CAPA form. And it's very similar to the Form 1, but it's only filled out by Dr. Holmes, Dr. Cooperman, or Dr. Nisujima, or if there is a second attending in BPOD, but that last case is pretty rare. However, if you do notice that one of those doctors is in the ED, then we would grab a CAPA form, put a patient label sticker on it, and we would go ahead and ask them to fill out the form. And once they fill it out, we would take that form and turn it in the same place we would turn in the Form 1 and the screen failure form. That pretty much concludes this video. Hopefully that was helpful in terms of validation. Thank you so much for watching it.